Hello, my name is Brian Pierce, and today I will be performing the mental status exam. Ms. Debbie has given me permission to perform the mental status exam. Um, Beginning the presentation, I will explain what all goes into the mental status exam, and then I will demonstrate how to do a mental status exam. The mental status exam is used to assess the person's appearance, behavior, cognitive, and thought process. Throughout the interview, you will do two parts of the exam through observation, and that's you will observe their appearance, the person's appearance, and the person's behavior. We'll start with the appearance. How's her posture? Is she sitting up in the chair? If she was in the bed, is she sitting up in the bed, or is she slumped over, curled up with her muscles tense, or sitting on the edge of the chair and real fidgety in an anxious-like state? How's her body movement? Are her muscle movements voluntary or involuntary? Is she spastic or they're smooth? How's her dress? Is her dress appropriate for the setting? Is it appropriate for the season? Is her dress appropriate for her age and her gender? And for this interview. Next, we'll assess her grooming. How's her hair? Is her hair combed? Is she well groomed? Does she have a body odor? How's her fingernails? We'll assess all that is assessed in her grooming and her hygiene. Next, we'll move on to her behavior you'll assess her behavior throughout the interview. Is she lethargic or is she attentive? Does she respond appropriately throughout the interview? Is she able to follow along throughout the interview, or is she lethargic? We'll assess her facial expression depending on the questions that are asked. How's her facial expression? Is it appropriate based off the questions, or is it masked like the same throughout the interview? Also, we will assess her speech. How's her speech throughout the interview? Is she able to articulate her words? Is she able to use the correct word in depending on the question that's asked? And we'll start the cognitive section of part of the mental exam by assessing Ms. Debbie's orientation. And we'll do this by doing the following. Ms. Debbie, can you tell me what time it is?
It's about 4:30.
Okay. Mm-hmm. Can you tell me where you are right now?
I'm in a dining room.
Mm-hmm. And can you tell me the date?
July the 13th, 2018.
Okay. Based off these answers, Ms. Debbie is orientated times 3, and that's good. It's good to get a baseline orientation on your patient. This can changes in a patient's orientation can tell you a vast amount of things that's going on with them. It's normal for hospitalized patients to get the date wrong on the orientation questions because it's easy to get your dates mixed up in the hospital. Acute disorientations in patients that were once orientated can be caused by issues such as respiratory issues, infection, and medication intoxication. Disorientation also occurs in patients with delirium and dementia. So, next we'll assess the attention span of Ms. Debbie. I will do this by asking Ms. Debbie a question with a series of directions in them. We'll see if Ms. Debbie is able to follow the directions question correctly. Ms. Debbie, can you please take a glass of water in your left hand, take a sip, shift it to your right hand, and place it on the table. All right. Ms. Debbie was able to get all parts of the direction correct. This assessed her attention span. She was able to follow my directions and pay attention to what I was saying and complete the directions correctly. Next, we'll assess her recent memory. We'll do this by asking Ms. Debbie the 24-hour diary call. Ms. Debbie, can you tell me what you've eaten in the past 24 hours?
Well, at about 12 o'clock today, I ate vegetable soup and popcorn. Mm-hmm. This morning, I ate pancake on a stick. I didn't eat anything for supper last night, but for lunch, I ate pasta and salad, green salad, and fish.
All right, good deal. Ms. Debbie was able to tell me what she's eaten in the past 24 hours. This screams for the occasional person who makes up stories to fill in the gaps of memory loss. people that do this people who have recent memory deficit, have disorders such as delirium, dementia, or Korsakoff syndrome, and chronic alcoholism. Next, I will test Miss Debbie's remote memory. Miss Debbie, can you tell me what you did for your past birthday?
Well, me and my husband took off a week and we did different activities
Mhm.
every day.
That sounds like fun. You can assess the person's remote memory by describing their past, by asking them to describe their past health history, their past job, past birthday or anniversary dates, or any historical past event in their life. By asking this assesses the person's remote memory. Abnormal answers would be answers the person is not able to recall any past events in their life. And this occurs in people with Alzheimer's, dementia, and damage to the cerebral cortex. Next, Ms. Debbie will start a part of a test and then we'll finish it later on in the interview. And this will test for her ability to learn new items. Ms. Debbie, I'm going to tell you, I'm going to give you 4 words. I want you to remember those 4 words and recall them to me whenever I ask for them later on in the interview. Those 4 words are brown, honesty, tulip, and eyedropper. All right. Next, we'll move on and assess Miss Debbie's judgment. Miss Debbie, can you tell me what you see yourself doing in the next 3 years?
Finishing nurse practitioner school and raising a baby.
Okay, good deal. To assess her judgment, we will ask her questions about future events. And based off her answer, we will see, is her answer logical? Is it realistic? Is it goal orientated? Abnormal answers would be like impulsive answers, like just spending vast amount of money and buying unrealistic things. But based off her answers were realistic. Next, we'll assess Miss Debbie's thought process and her perception. This assesses what Miss Debbie, how Miss Debbie perceives things and how she thinks things through. Miss Debbie, can you tell me, how do people treat you?
They treat me with respect.
Okay. Miss Debbie, do other people talk about you?
I'm not sure.
Okay. Miss Debbie, do you feel you are being watched, followed, or controlled?
No.
Okay. Is your imagination very active?
Yes.
Have you heard your name when you're alone?
No.
Okay. Based off Miss Debbie's answer, they were logical and they was pretty consistent. If abnormal answers would be yeses and vast amount of those, and these occur in people with auditory or visual hallucinations, people with psychiatric disorders or organic brain diseases, people with psychedelic drugs, or people with tactile hallucinations, and that occur from acute alcohol withdrawal. Miss Debbie, can you give me those 4 words that I asked you to recall to me?
Brown, honesty, eyedropper, and tulip.
Yes, ma'am. That's correct. Miss Debbie was able to give me all 4 words correctly. This shows that she doesn't have a problem with learning new material. A score of 0 or 1 word recall. This occurs in people with Alzheimer's, dementia, or people with anxiety and depression. Next, we will screen Miss Debbie for anxiety disorder. We will do this by using the GAD-7 test. The GAD-7 test is a test that assesses for the 4 most common anxiety disorders. Those disorders are generalized anxiety, panic disorder, social anxiety disorder, and post-traumatic stress syndrome disorder. Score of 10 on the GAD signifies generalized anxiety disorder. Scores 5, 10, and 15 represent mild, moderate, and severe levels of anxiety. The test is based off of a scale of 0 to 3, with 0 being not at all, and 3 being nearly every day. So, Miss Debbie, I'm going to ask you 7 questions, and you base it off of a scale of 0 to 3, with 0 being not at all, and 3 being nearly every day. So, over the last 2 weeks, how often have you been bothered by the following problems? Feeling nervous, anxious, or on edge.
3,
Not being able to control or stop or control worrying.
3,
Worrying too much about different things.
3,
Trouble relaxing.
2,
2. Okay. Being so restless that it is hard to sit still.
0,
Okay. Becoming easily annoyed or irritable.
3,
Okay. Feeling afraid as if something awful might happen.
2,
Okay. So based off the answers, we would tally up each column and then add them up. Based off of our answers, Miss Debbie has a score of 16, and that signifies generalized anxiety disorder in severe form. We will further assess that and seek Miss Debbie the additional help that she will need for it. You can further assess that by asking Miss Debbie, is it anything major going on in her life, or is she experiencing a lot of stress currently at the time of this test? Next, we will screen Miss Debbie for depression. We will do this by asking her 2 questions. Over the past 2 weeks, Miss Debbie, have you felt down or depressed or hopeless?
no,
Okay. Over the past 2 weeks, have you felt little interest or pleasure in doing things?
no,
Okay. Positive answers will seek that Miss Debbie could potentially be depressed, and we will seek her the additional help that she would need if she did answer yes to these 2 questions. Next, we will screen Miss Debbie for suicidal thoughts. Miss Debbie, have you ever felt so blue you thought of hurting yourself?
no,
Do you feel like hurting yourself now?
no,
Do you have a plan to hurt yourself?
no,
Okay, based off answer to number 3, do you have a plan to hurt yourself? I would ask her number 4, which is how would you hurt yourself? But she doesn't have a plan, so I don't have to ask her that. Miss Debbie, do you have thoughts of harming others?
no,
What would you do if you were dead?
I don't know.
I'm sorry about that. What would happen if you were dead?
I'm not sure.
Okay. How would other people react if you were dead?
Probably they would probably react in sadness.
Okay. Miss Debbie, based off Miss Debbie's answer, she doesn't have any suicidal thoughts. If she did, we would seek her the additional help that she would need. That concludes the mental exam. Based off the answers that she's given us, we would document accordingly and keep that as her baseline assessment to be used throughout her course of stay if she was in the hospital setting or throughout each time she visits the clinical setting. And that concludes the mental status exam.